Good evening and welcome back to the show. Thank you for joining us here on Bayou Time. Very glad to have with us Dr. Craig Walker, founder, president, and medical director at CIS, Cardiovascular Institute of the South. And while we know that September is Peripheral Arterial Disease Awareness Month, you just got back from something pretty special.
I did. I got back from the Transcatheter Therapeutics meeting, which is the biggest interventional meeting in the world. Wow. And at that meeting, we presented the data on laser for in-stent restenosis of leg arteries. It's the first ever randomized, blinded, controlled trial of laser. It was a very positive study, wow. And I was actually the principal investigator of that study.
Wow. Well, listen, those of us who know you and have known you for years know that you are on the cutting edge always of life-changing procedures, life-changing opportunities, and that's what CIS has done. And why I mentioned earlier, world-renowned. I've known people to come down to have procedures done and surgeries done from all over the world because of CIS.
Yeah, we really have had a lot of people come from all over. We're many years ago, we realized that we had to go back and look at things in a more global way. When William Harvey in 1561 described what we now know as circulation, the base word was circle. It means blood always goes around in a circle.
Right.
And so we start with a pump, that's the heart. Then we have the limb that carries blood away from the heart into the tissues, that's the arteries.
Right.
And then once it goes through the arteries and gives off nutrients and oxygen, the blood then has to return to the heart, where it picks up oxygen again, and it just keeps circulating. And problems of any of those are real problems for patients.
Yeah.
So we wanted to complete that loop. We wanted to deal not just with the heart, but with the arterial side and the venous side.
And the venous side. Wow. And so this peripheral arterial disease, can you just describe what that is?
Sure. Well, it's a whole lot of things, but predominantly what we're speaking about are blockages in the arteries going to the legs. It's actually more than that.
Right.
Because it can be blockages of the arteries that could supply the gut vessel with blood, that supply the arms with blood,
sure.
Or the kidney arteries with, or the kidneys with blood. But for the most part, we're talking the legs.
Okay.
Leg arteries are actually the most likely arteries to develop blockages in the whole body. And it's a huge problem. It's estimated right now that over 20 million Americans have peripheral arterial disease. Earlier estimates were much less than that, and then as we started to look at the real demographics, it was much higher. What's very interesting is that it's going up, not down. And the reason it's going up is twofold. Number one, people are living older. This is a disease of senescence, or as we get older. And secondly, we have an epidemic of diabetes. And so when one puts these together, we have a big problem. And this results initially in loss of function. People can't exercise like they want. They develop pain.
Right.
There's some suffering associated with that. But the really bad part is when you end up having to have a leg cut off because of this. And so this is the leading cause of amputations. And I've really devoted a lot of my life to helping to avoid amputations. And it's amazing how far people will travel. We've had people from Thailand, from Africa, from South America. People have traveled here to Homa for treatment to avoid that. And I might put in a plug and say that they were able to keep their legs.
I know that's right. And 60% of those amputations are from people with this disease. So 60% of those amputations that people have.
Yes. Yeah, you know, in war-torn zones, of course, amputations are predominantly from trauma, bombs and things like that.
Right.
But short of that, people losing legs almost without exception, if it's not trauma, it's from blockages. And so worldwide, peripheral arterial disease is the leading cause. And you know, I don't want to slight peripheral venous disease, because in actuality, it's even more common than arterial disease. And many of us don't really realize all of the manifestations. Now, whenever I talk about venous disease, people think, well, if you have a varicose vein, that's those big rods that you see on the back, and they're ugly, and that's the whole problem. Well, to start with, there's a lot of venous disease where you see nothing at all other than just leg swelling. But many of those people have pain. Secondly, actually, there's much more severe disease processes than those varicose veins. People who have started to develop brownish discoloration of the lower legs are much more apt to have problems with venous ulceration and the problems from that than people with the big varicose veins.
Right. And now, getting back, what are some of the risk factors for the peripheral artery disease,
Yes.
that arterial disease?
They're the same, Keith,
Okay.
as heart disease.
Okay.
Except in the case of peripheral arterial disease, several are a little stronger. Diabetes is a huge risk. It really disproportionately affects the legs.
Right.
Cigarette smoking. Cigarette smoking tends to affect the bigger arteries, those in the abdomen, those from the hip to the knee.
Right.
Diabetes tends to affect vessels below the knee.
Oh,
That's
wow.
where they typically affect them. However, family history, high blood pressure, high cholesterol all play a role. So patients who have peripheral arterial disease often have heart disease. And this is one of the things that I think we've missed a real opportunity with. If we put our finger on a foot pulse of a patient and find no foot pulse, we've identified more than a patient at risk of a leg problem. We found someone who's very likely to have heart disease, who may be at risk of a stroke.
Right.
And so it has been really one of my goals in terms of education to make people make those statistical associations. I really believe a complete physical exam includes careful palpation of the foot pulses. I think without that, one has not done a careful physical exam. If those foot pulses are absent, that person doesn't necessarily need a bypass or need angioplasty, but he does need to be worked up. He needs to lower his cholesterol. He needs to quit smoking. He needs to be followed, because that may be an opportunity to not just save his leg in the future, but save his life.
Yeah, and it's something that they can do. It's an environmental change that they can make.
It is.
And it's an individual thing.
It is.
Instead of you having to come in and do some major procedure or some minor procedure, they can do something. Gives them the power to do that.
It is, and it's so easy to detect. First, just feeling a foot pulse. But even if that is not the end answer, because sometimes that's not definitive, the next step is equally as easy. We simply put blood pressure cuffs on the legs and measure pressures in the feet. They should be the same as the arms. If they're not, there's a problem.
Right.
So if we see less pressure in the feet than we see in the arms, the only explanation for that is a blockage.
And then there are so many opportunities from there to do something about that.
There really are, more so than I think one can imagine. You know, historically it was taught one could not cross total occlusions, that, you just simply could not help these people. That is simply not true. In today's world, of patients who were told their only option was a major amputation, we've been able to save more than 98% of those limbs. I'll say that again.
Wow.
More than 98% of those limbs. That's a big deal. Now, some of those patients may lose a toe if it's already gangrenous, or they may lose a portion of the foot, but they can still walk. They can still take care of people. Tom Dempsey, for Christ's sakes, kicked a world record field goal with part of a foot.
63.
He was able to compete at a professional athletic level. But when one gets their leg cut off below the knee or above the knee, that is a much different situation, and it's associated with a much worse prognosis. And here's the point that I think so many people miss.
Okay.
Once you cut your leg off, it doesn't mean it quits hurting. It continues to hurt. There's something called phantom limb pain.
Yeah.
And often patients who have had to have their leg cut off because of blocked arteries, actually after amputation, experience more pain than they did before amputation. So many patients who are in chronic pain say, just cut it off, thinking that solves the problem. It does not.
It does not, right. Because that blockage very often can stunt some of those neurons and feeling neurologically, but that phantom pain is very, very real.
It does. The nerves are then damaged and you haven't helped. So really, always the best situation: restore blood flow, heal the leg.
I love it. Now let's talk about the Vein Center at Cardiovascular Institute of the South. We talked a little bit about venous disease already, but spider and varicose veins, those are a little confusing. You mentioned some of the larger veins.
Well, let's discuss the venous system in general.
Okay.
To start with, the most important veins are the ones that run deep in our limbs, and those run right near the bone. We call those deep veins.
Right.
Next, we have veins that are closer to the skin, which are called superficial veins.
Okay.
And then right under the skin, we have what are called reticular veins.
Okay.
And then there are connecting veins between each of those levels.
Right.
So most of the flow occurs in the deep veins. But varicose veins, for instance, are a problem of the superficial veins, the ones that run right under the skin.
Right.
Now, veins have to make blood flow under very, very low pressure, so there are a series of valves. And the biggest problem with veins, other than simply clot, which we all know about, is when people develop problems with the valves in the veins. Okay. Women often do it related to hormones or pregnancy. Men often have this problem as well. It's a misconception that men do not get this. Many do.
Sure.
Any occupation that stands upright a lot is more likely to get the problem. And what happens is these superficial veins, which should simply be moving blood up to the heart, are unable to do so because the valves aren't working. So the blood pools in the feet. And what happens is that causes pain because it distends the vessels, it increases pressure, and so there's pressure from the inside out pushing on the tissues. It hurts, and in the worst forms can form ulcers. So it really does affect part of the circulation. And when we're able to fix that, what happens is not only do the ulcers heal, but often the pain goes away.
Wow. Very nice. Now, in our last minute and a half or so, let's talk a little bit about some of the venous services offered at Cardiovascular Institute.
Sure. Well, I look at veins. I break up venous problems into three types.
Okay.
One is a clot.
Right.
Okay, thrombophlebitis and developing a clot in a vein is potentially very dangerous because the clot can break loose, travel to the heart and then out to the lungs. And when that happens, we have a pulmonary embolus, and it's actually the second leading cause of sudden death.
Right.
It's a big problem. It frequently follows being injured or having major surgery, but it's something we can protect against with appropriate anticoagulation or, in certain cases, by placing a filter between the legs and the heart. So that's clot.
Right.
Secondly, I look at central venous occlusion. Now you say, how does that happen? Well, anatomically, about a third of people have some compression of the left iliac vein. Where the right common iliac artery crosses over the left iliac vein, it often pushes it against the spine. And so the blood flow doesn't occur as well on that side. That's a real problem. So that's why more clots occur in the left leg than the right leg.
Oh,
otherwise,
that's interesting.
Otherwise, statistically, it would be the same.
Right.
Then sometimes this develops intense strictures. We're able to fix that with stents. I had one patient who had an ulcer for over 30 years who healed in 1 month after having iliac stenting. Wow. And then the third and the most common problem that affects up to a third of adults is venous insufficiency, where these valves leak. Certainly, a lot of women hate it because it doesn't look good. It gives unsightly veins. The little reticular veins that we see under the skin, those are easily treated. We simply inject those, they go away. Varicose veins, there are several components to treatment. One, we try to diminish the pressure head, and that's, again, easily done in an office. The second part is if they're really unsightly veins, we're able to make those score down where you can't even see them. And so I think there are many, many new emerging technologies on the venous side. They're very easy. Typically, everything except these central venous stenoses in the treatment of pulmonary emboli, we actually do in the office. It's a very easy thing, and typically people improve dramatically.
I love it. And I want to tell them where they can reach you in case people have questions at 1-800-445-9676. I'll tell you that number again, 1-800-445-9676. Dr. Walker, as always, love the wealth of knowledge and information that you have, just being able to sit and talk about the things that you've been so passionate about for helping the people of our area and so many others.
Thank you, Keith. You know, sitting in our background here is our real vein expert, much more so than I just talk a lot more. But Dr. Anil is really the super vein expert within CIS. And if someone has an issue with this, ask for him specifically.
Ask
He's
for
very
Dr.
good.
Anil.
Dr. Anil.
And if you know him well, you call him Dr. Anil Shagalamude.
That's it.
Very good. Thank you so much, Dr. Walker. When we come back, we'll be next up with To Your Health with Terrebonne General. Don't go anywhere.